Welcome to Psyche Snacks. This is the podcast where we talk about mental illnesses and how to help those struggling with them. I recently had the wonderful experience to get to go to a mental health first aid class and get a mental health first aid certificate. And I did this just around the time I also got my regular first aid certificate, and I thought it was really cool to see some of the differences that came with helping someone physically and helping someone emotionally, and also helping someone physically from something that happened emotionally or helping someone emotionally that happened from something physically, and how the two can go hand in hand. I personally think that mental health first aid is very important, and I definitely recommend if anyone has a chance to take a class in their area to take that chance, because I learned a lot of things and also just had a lot of the things that I've talked about in this podcast come into perspective a little bit. So, this podcast episode is about anxiety and OCD. So, we'll start with what we always start with, a nice definition. So, the Oxford Dictionary defines anxiety as a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. So, a lot of the times when you hear anxiety in the world, it's related to some big event coming up or something stressful occurring in someone's life. And that can be a feeling, but when does this feeling of anxiety become a disorder? And the answer to that is when it is repeated over a period of time and starts to significantly impact quality of life in an amount disproportionate to the outside situation. So, someone could be feeling a ton of anxiety constantly for months on end. But that would make sense if they were moving from house to house, having exams every day, or in a pit full of spiders. Uh, just as an example. And so that would make sense. That wouldn't necessarily be a disorder, that would just be an event in their life. But a disorder would be if it's disproportionate. So if they were in a pit of fake spiders, why would they be freaking out so much if the spiders are fake and pose no real harm to them? Could be because they have a phobia, which we talked about on episode 1. So, what are the characteristics of anxiety disorders? It's the feeling of panic, fear, dread, and uneasiness. There's feeling on edge or irritable, uncontrollable obsessive thoughts, which we get more into when we talk about OCD, difficulty concentrating, restlessness, heart palpitations. For those of you who don't know, a palpitation can be a sudden, extra large heartbeat, like extra loud that you can feel it through your body. Or it can feel like your heart's skipping a beat. You may have heard that term before. I experience these a lot because I'm going through some anxiety issues of my own, so this is really fun to talk about. There's shortness of breath, muscle tension, cold or sweaty hands, dry mouth, nausea, numbling, numbness or tingling in your hands or feet, and difficulty falling asleep or staying asleep, which is insomnia. Now, the fun thing about numbness or tingling in hands and feet, I experienced this a lot growing up. I thought I made the connection that my fingertips would hurt in certain situations. I didn't know that that was because of anxiety. I just knew my fingers hurt because I'm in this situation. Anyway, on to different types of anxiety disorders. There are phobias, which we discussed in episode 1. You can go listen to that if you want. Panic, which is a disorder of multiple instances of panic attacks. So, panic attacks can be symptoms of many other mental illnesses and often don't have a specific trigger, unlike phobias. There's generalized anxiety, frequent and unfounded anxiety, and stress throughout the day. I get this one a lot. Very fun. It's not actually. Don't recommend. Social anxiety, formerly known as social phobia, which is an intense fear of being judged or watched by others. I talked about this in my last podcast where I interviewed my mother. Um, I apparently did really well hiding it because she didn't even know. There's separation anxiety, which is an anxiety when someone is separated from a loved one. This is normal in toddlers because they are learning to form attachments, and it's a normal part of their development to feel anxious when those attachments are taken away, but this is abnormal when they become children or adults. And then there's selective mutism, which is someone who's not talking in certain situations because of anxiety. It's common but not exclusive to children. So I have a few personal experiences with anxiety. I talked about my social anxiety experience, my intense fear of speaking out, my heart pounding, shaken even at the thought of social situations, even when alone, and then the whole story with my principal and how it was better for me to just walk to go all the way around the school to go through a different entrance just so I wouldn't have to interact with my principal. And this continued right up until COVID. And when COVID started, I didn't have to see anyone. I literally just claimed the basement of my house, of my parents' house, as my office. And I sat down there with my cat and did my homework all day. And that was my happy place because there was no people. All I had to do was school. And then I also learned how to play chords on my violin when things got really stressful. So that was really cool. And through that, I was able to help gain my self esteem back and get over some of my social anxiety symptoms. And then, of course, generalized anxiety. I've had panic attacks in the past, and this has led to, these are pretty extreme, has led to fainting. And then one time I was pretending to have a panic attack for like an acting thing I was a part of, and I actually fainted for that, and that's when I broke my jaw. So that's a fun story. Um, but lately, I've had small anxiety attacks, and I've learned through things I've learned through meditation to accept the feelings that I'm feeling, accept the thoughts, and just letting them flow on, not paying attention to them. And that way, it may be affecting me physically, but at least I'm not experiencing that mental toll of a panic attack. So, what can cause anxiety disorders? Main one is chemical imbalances. So the brain runs off of neurotransmitters like norepinephrine, serotonin, dopamine, and gamma aminobutyric acid. I totally said that perfectly. It's also shortened to GABA. Gamma aminobutyric acid. That's a fun one. Um, but because of these chemical imbalances, a lot of drugs like SSRIs, which are selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, can help with anxiety as they increase levels of serotonin and or norepinephrine in the nervous system. And these can help balance out some of those chemical imbalances. Another thing that can cause anxiety disorders is brain changes. So, the amygdala is the brain's central processor for emotions and stress. Anxiety has been linked to greater activity in the amygdala. And so, certain practices can help reduce that amount of activity. In fact, meditation has actually been shown to shrink the amygdala, resulting in lower levels of stress. And this can be found in a study called Effects of Mindfulness Based Stress Reduction, MBSR, on emotion regulation in social anxiety disorder. Other things that cause anxiety disorders are genetics. My sister also experiences anxiety disorders, and the environment. So, stress can be very damaging to the body, and long term stress can disrupt neurotransmitter levels. Some treatments for anxiety. We're on to this section. Um, so, like with phobias, exposure therapy can work. If there's a specific cause for anxiety, exposure to the cause in a safe environment can reduce the negative associations one may have with that thing. And if there's no specific cause, then exposure to the feeling in general can help lessen the symptoms. Like I said with my meditation, I learned to recognize the feelings I was feeling inside of me and live with them so that they could pass on more easily. Cognitive behavioral therapy, or CBT, is also often used, and that's through working through thoughts and what causes thoughts and trying to rewire your brain in a way. And as mentioned earlier, antidepressants such as SSRIs and SNRIs can help. Another class of drug that can help is benzodiazepines. They're commonly used for insomnia as well. They're also a controlled substance, and so they're a bit fancy. When I work at the pharmacy, we have to double count them to make sure we're not giving out too much because they do have a level of addictiveness to it, and there is a potential for abuse there. So yeah, they're also used in cysteine for sleeping for those with insomnia, which is a symptom of anxiety. Another thing that's used are beta blockers. They're an antihypertensive, so they lower blood pressure, and this can help with the physical symptoms of anxiety. So, for example, since I have gotten over a lot of the mental pressure of anxiety, but I still have some physical um, symptoms of anxiety. A beta blocker might be an option for me because that would take down my heart rate and help with my palpitations. and also the trembling and stuff. So, what if you come across someone on the street having an anxiety attack, or your friend comes to you with feelings of anxiety? Number one thing, it was stated by my mother, and it was stated in my mental health first aid class: active listening and compassion. So, quick, I want to do a detour to what I learned in my mental health first aid class. We used an acronym called ALGE to go through what we would do in a situation where someone needed mental health first aid. The A was for assess. So we have to assess this person and the state they're in, assess what resources they may need, if we need to call 911 or call their family or friend. Then the L stood for listen. And this comes back: active listening and compassion. Listen empathetically to what they're going through. It's not solve their problem or try to get them out of how do I say this? If they're in a situation where they're acting aggressively, it's not that you want to force them into somewhere safer, as ideal as that would be. It's better to listen to them, validate them, and reassure them that um, things are going to be all right. And when things calm down a bit, get them somewhere safe and quiet. In a lot of situations, that'll help. Um, and that moves on to the G in ALGE, which is give reassurance. And that's our validation. So what they're describing about their emotions may seem excessive or extreme, but it is real, and they're not overreacting or being ridiculous. It's not good to tell them to calm down, as that minimizes what they're going through and implies that what they're feeling is something they can just turn off at will. And then we get on to the E's. And so ALGE is spelled ALGEE. I don't know why, but I just signed that in ASL on my hand. But it's not like the green goopy algae, but it kind of is. It's actually the name of a koala, which is the mascot for the mental health first aid course. But the first E is educate them on professional resources. So be like, hey, what you're going through is real, validate them. There are places you can go for help. There's people that if you pay money to will help you. Your insurance will probably cover, so don't worry. And some of them are distrusting of doctors and stuff for whatever reason relating to their past. And so it's also good for the second E, educate them on strategies they can use for themselves. So coping strategies such as meditation, which can be very helpful for trying to prevent future instances of anxiety. But it's important that you don't assume that they want you to fix their problems. Often the only problem is the emotions they're going through, and trying to fix outlying issues when all they need is emotional support will stress them out more. It's important to discourage unhealthy coping mechanisms such as drug and alcohol abuse, and also it's important to show your support in them working through their emotions, getting professional help. It's good to not pressure them into doing something that causes anxiety. So if you know a friend of yours has struggles with anxiety, maybe don't go bungee jumping with them if that's something that could trigger their anxiety. And if you're already there, don't make them feel pressured to participate in any activity that could cause this anxiety, because it's not your job to be their exposure therapy. You need to leave that to trained professionals in a safe environment. So, on to OCD. How does anxiety relate to OCD? So, OCD is not considered an anxiety disorder, but anxiety is a common symptom of OCD. Now, what is OCD? The Mayo Clinic defines it as a disorder that features a pattern of unwanted thoughts and fears known as obsessions. These obsessions lead you to do repetitive behaviors, also called compulsions. These obsessions and compulsions get in the way of daily activities and cause a lot of distress. You may have heard someone in the past going like, "Oh, I'm so OCD," relating to the fact that they just like to keep things neat and orderly, but that's not a disorder. It's a disorder if it interferes with their quality of life. With OCD, it's more than just needing things to be a certain way. It's also the fear that if something isn't a certain way, something terrible will happen or people could die. It can get really serious and weigh down on their conscience a lot and occupy a lot lot of space in their head, leaving them distracted, disoriented, and generally feel fearful. So, what are the symptoms of OCD? Um, well, breaking it down, there's obsessive and compulsive. So, some obsession symptoms are fear of being contaminated by things others have touched, doubts that you've locked the door and turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts of shouting obscenities or not acting the right way in public, unpleasant sexual images, and staying away from situations that can cause obsession, such as shaking hands. And common themes of OCD obsession are fear of contamination or dirt, doubting or having a hard time dealing with uncertainty, needing things to be orderly and balanced, aggressive or horrific thoughts about losing control and harming yourself or others, and unwanted thoughts including aggression or sexual or religious subjects. And then there's a compulsion side. Some compulsion symptoms include acting on these obsessive thoughts, hand washing until skin becomes raw, checking doors over and over again to make sure they're locked, checking the stove over and over again to make sure it's off, counting in certain patterns, silently repeating a prayer, word, or phrase, trying to repeat bad thoughts with a trying to replace a bad thought with a good thought, and arranging canned goods to face the same way. And common themes of OCD compulsion include washing and cleaning, checking, counting, ordering, following a strict routine, and demanding reassurance. So, OCD can be mild to severe, but again, it's more than just obsession and compulsion. It's the fear that something can go wrong. And if the obsession is not attended to, then it will be this person's fault. So, I have some personal experience with certain symptoms of OCD. I'm not saying I have OCD because that requires medical diagnoses. I'm just showing how different symptoms can present. So, in elementary school, if I crossed my legs one way, for example, right over left, then I had to go back and cross my legs left over right, uncross them, and then cross it left over right again before I could go back to being crossed right over left. Because I had to have that even feeling on my legs. I had to have two crosses on my left leg and two crosses on my right leg. Same with folding my hands, interlinking my fingers together, or stepping on a crack. If I stepped on a crack with one foot, I have to step on a crack on the other foot, and it had to be in the same place. But then by the time I stepped with that foot, the feeling on the right foot would wear off, and so I'd have to step with that foot again. And it was something that occupied my brain a lot while I was just trying to take a peaceful walk through the neighborhood. So, and then in middle school, I must have like seen a movie or something that taught me about the butterfly effect, and it really made me think like just the smallest flap of a butterfly wing could change the course of history. And made me think like, oh, if I breathe wrong in this situation, someone could end up dead because of this wild chain reaction of events that happened. And it was something that occupied a lot of my brain. It was really easy to get sucked into this wormhole of what could happen, what I could accidentally end up doing. And my mind entered a space where thinking like this was a habit. I would latch onto all sorts of different actions and possibilities of each one cycling endlessly, and it started affecting my everyday life, having symptoms of a disorder. And then I recognized eventually I needed to change this thought pattern because it wasn't helpful for me to think about all these things. And eventually I was able to recognize that the smallest things I do would not have any effect on the world around me. Whether I took a step to the left or right didn't matter. Whether I crossed the street to the left or the right didn't matter. I probably wouldn't end up getting hit by a car just because I took one step to the left. And so I was able to recognize that I am insignificant in the world, and to a lot of people that's scary, but to me it was comforting because I really worried about how significant my actions could be. So, on to what can cause OCD. It could be a natural cause of the body's biology, um, just wanting to make sure everything's okay. Um, it's also shown some genetic components, and it can also be a learned behavior from family members or peers. And treatments often include, from professionals, include psychotherapy and antidepressants. I know a certain combination um, of fluoxetine and another drug that I forgot can be helpful in decreasing some of these obsessive and compulsive behaviors. There's also various brain stimulation techniques such as deep brain stimulation or DBS and transcranial magnetic stimulation, which is TMS. I don't know much about those, so you should probably look those up if you want to know any more about that. Um, if someone comes to you having struggles with symptoms of OCD, it's important to exercise active listening and compassion, as well as validation. And another thing is avoid accommodating their compulsive behaviors, as that perpetuates the cycle of fear, obsession, anxiety, and compulsion. Even though it may hurt them emotionally, it's in their best interest for you not support their compulsions. If they have to check for the third time that the stove is off, tell them, hey, I already checked for you. The stove is off. You don't need to check. Instead of encouraging them, saying, hey, you should check the stove again. It might be on. Because that just perpetuates the fear and the compulsion. So, in conclusion, we talked about anxiety and how you can help someone with anxiety, as well as OCD, and we also reviewed some of the steps in ALGE, which is assess, listen, give reassurance, educate them on professional help, and educate them on self care. I hope you enjoyed this Psyche snack.